Good morning, good afternoon, and good evening. Today we will be discussing Parkinson's disease. Let's begin. Let's first define this condition. It was described by James Parkinson, so it's named after him, in 1817, which is almost 200 years ago. It was first described as the shaking palsy because one of the most prominent symptoms of this condition is tremors. Parkinson's disease involves the generation of dopamine producing cells in the substantia nigra. So if we remember from neuroscience, dopamine is can be excitatory and inhibitory depending on the receptor that it can bind to. So in the basal ganglia, we have a D1 receptor and a D2 receptor. A D1 receptor would induce an excitatory effect, while a D2 receptor would induce an inhibitory effect. But the main point here is that dopamine is very important for facilitation of motion, right? So if there is a degeneration of this dopamine, it could lead to Parkinson's, which we will be discussing further as we go into this presentation. One notable fact is that Parkinson's is a progressive disorder. That means it gets worse over time. So let's go to the pathophysiology of Parkinson's. How does it come? How does it happen? So I want to point out two important concepts here. Again, as I've mentioned, dopamine. There is a loss of dopamine synthesizing neurons in the ventral tier of the substantia nigra pars reticulata. And substantia nigra is very important for the facilitation of movement. And we also have Lewy bodies, Lewy. So Lewy bodies are a pathological hallmark for Parkinson's disease and, in general, neurodegenerative diseases. These can be found in the nuclei of the remaining dopamine synthesizing neurons. An important note here is that by the time that a patient presents with Parkinsonian symptoms, at least 60% of dopaminergic neurons in the substantia nigra have already been lost. So you can see how much destruction has already occurred before the patient can even present with the main symptoms of this condition. So it's very progressive and it's quite difficult to treat. It takes a long time. So I'm going to discuss more about Lewy bodies. Let's go to this slide. So what is a Lewy body? So a Lewy body, or bodies, basically it's formed by ubiquitin and aggregated alpha synuclein, right? So these are just proteins. But it becomes harmful when there are abnormal clumps of this protein. This is usually found within the brain and throughout the body since it's a synaptic protein. But if the form or the shape is manipulated or changed, it could lead to abnormal clumping, which is what we call a Lewy body. So again, as I mentioned earlier, Lewy bodies is not solely exclusive to Parkinson's disease. It can also be a hallmark of neurodegeneration within non-dopaminergic cortical neurons of patients with one form of progressive dementia. So I will discuss that later on because we have dementia with Lewy bodies. So that's different from Parkinson's disease. So what actually happens is that when we have Lewy bodies, the abnormal clumps, these can choke, quote unquote, choke the neuron. And what is a neuron important for? It's important for signal transmission. So if you have a clump that disrupts that transmission, it could lead to degeneration in the signal transmission, right? There's affectation of it. Also, Lewy bodies can kill. That's an exaggeration, but it can affect dopamine neurotransmitters that travel to the substantia nigra. So I want you to look at this chart here. So this is just a very introductory part to the medications that are used for treating Parkinson's disease. So in the y-axis, we see that this is the change in total UPDRS from baseline. So UPDRS means Unified Parkinson Disease Rating Scale. So basically, it just presents the effect of medication with Parkinson's. So the lower the numbers here, the more effective the reduction of syndromes become. So you can see here 600 milligrams of medication that would treat Parkinson's could decrease their symptoms. However, look at the group that had a placebo treatment. So they still had very worse symptoms as compared to the people who had adequate amount of medication. So what medication did they use to treat this? So remember this because this is very important. This is the main character of this whole presentation, really, aside from Parkinson's, of course. Levodopa. Levodopa is a very important drug that has been used for a very long time to treat patients with Parkinson's disease. It is a drug that the brain can convert into dopamine so that we could compensate for loss. And usually levodopa is used as a gold standard for diagnosing Parkinson's disease because when you diagnose a patient, right, you could try and put them on levodopa and see their response. If their response improves or becomes worse, you can further pinpoint is this actually Parkinson's or not. So I will be discussing levodopa furthermore in the last, I apologize for that, in the last few slides, which is a bit ways out. So let's move on. Let's go to etiologies. Honestly, there is no concrete, not really concrete, like absolute cause of what really brings about Parkinson's. So we only have proposed etiologies, proposed causes. So number one is aging. So due to decreased vulnerability of to disease and or injury. So that's very straightforward. The older you get, a lot of things become, yeah, I can feel it too. I'm getting older. Okay, next is toxins. So alcohol, cigarette smoking, the bad habits. Although these are not fully confirmed. Again, it's mostly idiopathic. We don't really know the exact cause of how a patient can get Parkinson's disease. There are some genetic propositions, but I won't go too deep into those because that's not really the main point of this presentation. I just want to give an overview of Parkinson's. So this is it for this part. I just want to make it really short. I just want to introduce what Parkinson's actually is and introduce the pathology of it, of how it comes to it, and what causes it. In the next presentation, I will be explaining it further. So, goodbye.